We're here today with Dr. Patrick O'Shaughnessy, the President and Chief Executive Officer, Catholic Health. Sometimes everyone around him refers to him as Dr. O. Dr. O, thanks for joining us today on LIBN and for this important forum where you are the keynote speaker.
Joe, thank you so much. It's truly an honor and a privilege to be with you here today. And I'm also honored to be the keynote for Long Island Business News on this very important topic. It's great to see that you have a healthcare forum and excited to conduct our interview together.
Well, thank you very much again for joining us. Let's start out with something that is on the mind of many Long Islanders, but is sometimes hidden. It is the question of food insecurity and how it relates to health. If you would, Doctor, paint the picture for us of the face of food insecurity on Long Island.
Yeah, absolutely, Joe. Be my pleasure. Let me first cue up, who we are. So Catholic Health is a health system that spans Queens, Nassau, Suffolk. We're number 2 in size and scale. We have over 1,900 licensed beds across 6 hospitals, 3 nursing homes, home care, hospice. We care for anywhere from between 20 to 22% of the Long Island market, and we're growing. So we have a really strong footprint on Long Island. This is where we operate. This is where we live. Thanks so much for bringing up the topic and the concern of food insecurity on Long Island. And I think it's a big problem, quite frankly, nationally. I think it's a problem within New York that's we're all working hard to address. And currently in New York, there are over 2.4 million people facing food insecurity. And when you break the numbers down, that's about 230,000 people on Long Island, 68,000 of which are children, and 4% are seniors. And I think what really we saw across the health system and across the island is that the pandemic, what happened with COVID-19, really exacerbated the issue. And we're struggling with inflation and other things. So many folks are having issues around ensuring that they have enough, good, healthy food to eat. And as a healthcare system, I believe food insecurity is a strong concern because if you are food insecure, there are long-term negative health impacts that can happen as a result of that. So, we focus so much on working hard to reduce disease burden, but we also have to, in healthcare, work to try to keep people healthy. And as the saying always has been, you are what you eat.
I'd like to try kind of drill down on how widespread the question of food insecurity is and how specifically it impacts people's health.
Absolutely. Yeah. So look, the bottom line is this: consistently eating calorically dense, nutritionally depleted food accelerates disease. We know that. So to your point, Joe, it affects far too many children. And then you begin down this cascade where you're not eating the right foods. You can have issues around increased body mass index, obesity, and actually we're seeing more younger patients with cardiovascular disease. So it is a big issue. It spans across all age groups. It spans across all zip codes. And I believe by focusing on food insecurity as a system, we can improve the patient's quality of life, their overall health, trying to keep them out of the hospital. I know that may sound odd for a healthcare CEO to say that, but we are really working hard to do that and to reduce disease burden. And so I always say this: I believe we can bend the disease curve. And if we can bend the disease curve, we bend the cost curve, right? And when you look at the expenditures in our country as a percentage of GDP, it's not sustainable to have healthcare expenditure north of 20% of the total gross domestic product. Even though we have great outcomes of care, we're spending far too much. And it's because of the chronic disease burden. So even delaying that or reducing it, it has significant impacts on overall health, wellness, but also financial impacts that drive, I think, additional improvements economically as well.
Some of our readers and viewers here will ask the question, if people are worried about whether or not they have enough to eat, or if they are going to be able to feed their family adequately, what is the connection between that fear and then choosing the wrong foods, not eating the proper nutritionally valued foods that are necessary to sustain a healthy lifestyle. Can you make that connection?
This is the thing that troubles me most. You know, today in this country, we have the ability to have so many healthy foods potentially available, but unfortunately, it's the only time in history where those healthier foods, right, the fresh fruits and vegetables and even lean meats and fishes and things that you would get from, say, some specialty organic stores, they're cost prohibitive to so many people. You just can't afford to get them. So that's the real issue. You know, it's no secret. I mean, there's good literature, and you'll see more coming out because I think appropriately policymakers are saying, hey, if we're gonna put some money behind this, we need to see improved outcomes of care. So all that research is starting, and you'll start to see more and more papers being published around it. But it's no surprise, healthier foods are more expensive than foods that are processed and foods that are high in fats and sugars. So I think, you know, especially in some areas of our population, seniors, as an example, who are struggling many times to get by, they're on retirement incomes and whatnot. It's very hard to get access to the healthy foods that you need. And, you know, I've seen this, you know, time and time again where people would come in. Remember, I am an ED physician. So I would see people when I was clinically practicing all the time that would come in. And especially for our seniors, you'd ask them, well, you know, how have you been eating? What have you been doing? And they'd say, well, you know, it's tea and toast, or, you know, I picked up something from a fast food restaurant, or they actually would online order some cheaper fast food options. And it's just not healthy. So I think we have a bit of work to do to make sure that we can ensure that folks can afford the healthy food choices that we know can affect overall disease development and progression.
Can you give me an insight into what doctors are seeing, like what they're hearing when they reach out to their patients, or when their patients come to them? How does the issue manifest itself in the observations of healthcare professionals?
Yeah, so I think even within the healthcare profession, people are realizing that food plays a real impact on disease. And what I'm hearing, I think I alluded to this a little bit before, you know, we see all the time patients who come in that are screening in for heart disease at a far younger age than you would ever expect. So more and more people are developing atherosclerosis. They're requiring cardiac interventions. And we'd like to prevent that. We'd like to see the incidence and prevalence of these disease processes actually be reduced over time. You know, and we've done some remarkable things, developed some great drugs. We have some wonderful interventions, but wouldn't it be great if we can help keep people healthier and so that they don't need those things? And so physicians are realizing, especially on the primary care side, Joe, that we're taking time now to counsel patients. You know, we have dietitians in all of our Catholic health hospitals. We screen people on time of admission to see how their diet is and what we could do to make improvements. And so doctors are realizing that this has a real impact. But I'll tell you one other story, which I think is really important, about impact from community, which I'm so proud of our care teams here at Catholic Health. A few months ago, I received a letter from a woman who was thankful specifically to Catholic Health and Mercy Hospital because she actually did come into another health system, I won't name, emergency room with some physical complaints. And when questioned about why she felt weak, why she felt like she was passing out, she basically shared, I had no food to eat for 3 days, and was turned away because the thought was, well, there's nothing we can do. That's not our issue, right? That's a public policy issue. That's something where you need to get on governmental assistance. We feel differently. She came to Mercy. We took her in. We actually have in all of our emergency rooms, we have non-perishable to-go bags of food that when people do screen in or they need food. But again, realizing our core business and what we provide is healthcare services, we then work to do a warm handoff to governmental agencies to enroll them in things such as Supplemental Nutritional Assistance Program or SNAP or other agencies We work with the Health and Welfare Council of Long Island. We work with Catholic Charities. I'm very proud of the work our teams do to make an impact in that regard, because it all crosswalks. It all comes together. I used to always tell people all the time, in the emergency room, I hope I never see you again. And I mean that with all of my heart, right? Because if you're here with me, it means we failed. What's our role as a health system in that chain to help keep people healthy? And we think by incorporating these screens and then plugging people into the appropriate governmental agencies for support, we can make an impact.
You said something that really touched the nerve in me, and I bet you many of our viewers. You said that you have come to a program where you actually give out bags of food and
Yes.
supplies. I mean, how does that make you feel? We live in one of the most well-to-do communities in perhaps the world. This is Long Island, and we have people that hungry. How does it make you feel, and what do you think we should do about it?
Yeah, it's a sad state, because to your point, and as we discussed before, Joe, in this country, we all should have access to good, healthy food. And I was astonished during the COVID pandemic, and what really brought, and I always knew this was an issue, but so many kids, let's talk about the kids for a minute. So many kids rely on our schools as a source of healthy nutrition food. They get breakfast and they get lunch. And to the credit of our school system, so many of them, even though school was closed, they stood open just to provide meals. And we even volunteered to help in that regard. And then you start peeling back the onion and you start saying, oh my goodness, there are just so many people that don't have access to good, healthy food, or they're experiencing true clinical symptoms of food insecurity and hunger. So the question is then, what do you do about it? And so I wanted to do something about it. I feel very lucky and privileged to be doing the work I'm doing as part of this health system's efforts to have, as part of our mission, a great community impact, not just providing incredibly high quality health services, of which we do, but the social determinants of health determine so much around overall disease. So, I'm very proud of the work we did, because our teams came together and we, said, well, how can we make an impact? How can we make a difference? We have over 200,000 people visit our emergency rooms each year. Let's screen them. Let's ask them in a non-judgmental way, is this an issue for you? And if so, if you screen in, let's begin to help solve the problem. So every patient that comes into one of our 6 hospital emergency rooms gets screened through our hunger vital signs assessment tool. It's actually tracked in our electronic health record, so our teams can ask these questions easily. And then if they do screen in, we have food to go bag that's in a partnership with Long Island Cares. And so I would invite anyone who listens to this talk to say, work and partner with your community-based organizations. Even though your sphere of influence may be in a particular space, when you come together, you can do really great things. On their side, they wanted to be able to get screened more people. And so that they could get, to your point, Joe, we have food banks. We have other food sources available. They want to be able to get that food out. So why not use our ERs? Why not screen folks? When they screen in, give them a bag, which gets them a couple of days, but then we plug them in to other supplemental support through Catholic Charities, as an example, through the Health and Welfare Council of Long Island, and get them enrolled in supplemental nutritional assistance programs and other programs so that they have more long-term sustainability to get good, healthy food. In 2022, we implemented our 3-step food insecurity process in our EDs, which is basically screen, give it to go bag, and SNAP referral, which has been wonderfully received and we're making an impact. In 2023, we'll continue to integrate this throughout our health system into our ambulatory locations as well, right? Because not everybody, fortunately, has to go to an emergency room. They may go to their doctor's office, or they may go to one of the ambulatory centers. So, long term, our goal is for every person that Catholic Health touches to be screened and to get them the help that they need. Again, understanding we are a healthcare system, but we feel we play a role. And I think by working with community-based organizations, so many folks can come together for overall additive and improvement in the populations we serve. And we're doing this on the home care side as well. We created a pilot that delivers nutritious meals to homebound individuals. Again, tying into what I mentioned before about the challenges with seniors. So many of them can't get out and food shop. So we were able to actually go out and when we screen, if they screen in, we actually will bring food in as part of that home care visit. And here's the great part, right? When you look at the data, you'll ask me, you'll say, Dr. O, what's the impact? Did it make a difference? 90% showed positive health outcome improvement. And in the cohorts that we treated in the home care side of the organization, 0 emergency room visits and hospitalizations. So it plays a real role in an impact. So very excited about the work that we're doing.
That's remarkable, Dr. O, the program. Let's talk about the future a little bit.
Yeah,
We
sure.
see Catholic Health building, expanding, doing innovative things. Can you give me an idea of what is informing this building program? What's telling you it's time to grow?
Yeah. Thank you, Joe. So I'm very excited to lead Catholic Health into its future. I think our future is very bright. My vision for healthcare is we want to be the best place for folks to receive care, period. We may not be the biggest, we will be the best. And to do that, we have to have the very best and most talented workforce. We have to offer state-of-the-art care, but we also have to grow and expand and make key investments in brick and mortar and new locations with state-of-the-art facilities that can see patients in environments of which they want to be seen, right? So hospitals are very important. We have 6 of them, and they're 6 amazing hospitals, and we're going to be making significant capital investments in these plants, all right? That's for the most complex care and for those that require complex surgeries and hospitalizations. You may know at Good Samaritan Hospital as one example. It's now Good Samaritan University Hospital. We've put $500 million into a brand new patient care pavilion that will have a state-of-the-art large emergency room, 22 new state-of-the-art operating rooms, and private patient rooms. We'll make other investments in the 5 remaining hospitals to make them more modern. But we're also expanding into more of the ambulatory development space. To give you one example, there'll be different levels and sizes of ambulatory locations across Long Island. We're expanding into Queens and Brooklyn and out to the Forks. And these centers range in size from, as an example, our Centereach location will be 60,000 square feet, where it'll be on-demand access. You can walk in as an urgent care visit. You can see primary care. You can see a specialist. You can get imaged, and you can get a great cup of coffee and go about your day. And other smaller urgent care and on-demand visits that will spread across our market. So I always say it's delivering the right care in the right place at the right time by the right people. And you have to have that degree of differentiation. And so I'm very, very excited. When you look at the totality of the health system between the acute care enterprise, ambulatory, our physician network, our provider network is now over 2,500 providers and growing. Our 6 hospitals, our home care, we're a full service healthcare delivery system, and we feel very lucky and privileged to be providing care for so many Long Islanders across our markets.
Dr. O, last question. What will the next 5 years look like for Catholic Health and for Long Island's healthcare industry? If you had a crystal ball, what would it say?
So a few things. I think, the future for Catholic Health is very bright. You'll see us continue to grow and expand. You'll see us continue to make key investments in our people, first and foremost, which includes all of our caregivers at all of our locations, as well as make further investments in our clinical teams and services that we provide. And I also think you'll begin to see Catholic Health expand in terms of digital access and digital capabilities so that folks can connect in any environment across all of Long Island. I will tell you that I think in the healthcare environment in general, we all have challenges in regards to staffing and looking at the future and, recruiting, retaining, and building our next generation of healthcare workers. As I mentioned to you, for 18 plus years, I worked as an emergency room trauma physician. There's a high degree of physician and nurse burnout across all of healthcare, across all of the country. not specific to Long Island and not specific to Catholic Health. So we have to do more, I believe, to encourage our future generations to go into this incredibly noble profession. You can earn a great living, but you can also do good. And so that's the win-win. You can have a great career, a long career, but you also can do, I think, a lot of good to help people along your professional journey. And so I think we have a lot more work to do to stabilize the workforce and to make sure we have enough people. If you look at some of the stats, Joe, depending on who you read, by 2030, in the United States alone, we could have a shortage of nearly 1 million nurses and over 300,000 physicians. Who's going to care for all of us? So we have to do more to encourage our next generation of brilliant minds, women and men, to go into healthcare. It's a great profession, and they'll have an incredible career. Fortunately, I think New Yorkers and Long Island, we're very fortunate to have, I think, the very best of healthcare services available to our patients. It's not like that in other areas of the country. That being said, it is a very competitive environment, and we're seeing a lot of disruptors enter the market. We see venture capital has tremendous interest in the healthcare space. You see a lot of big box giants entering the healthcare space, companies like Amazon, and others that feel that they have an opportunity to deliver something that we didn't. So I'll tell you, we as a sector, meaning the healthcare sector, we need to get it right. We need to deliver exceptional care, an exceptional experience of care, and differentiated sites of service. And we need to continue to work hard to build our workforce.
The president and CEO of Catholic Health Services. Thank you very much for joining us today, Doctor.
Joe, thank you and Long Island Business News very much for this opportunity. It was a pleasure to speak with you today.